SeniorLivingGuide.com podcast discusses topics which are relevant to the everyday lives of seniors and their caregivers. We are joined by experts who share their knowledge on a variety of issues. SeniorLivingGuide.com podcast offers solutions and resources to create the best quality of life as we age. And now, let's welcome your host, Darlene Mahoney.
Thank you for joining us on this episode of SeniorLivingGuide.com podcast. We want to thank our listeners who have been the key to our success as we enter our third season of Senior and Caregiver Resource Podcasts. Our podcast can be listened to and followed most anywhere you enjoy music or podcasts, such as Spotify, Apple Podcasts, Google Podcasts, and even Alexa, and many more. And please don't keep our podcast all to yourself. Share with a senior or caregiver who you think will benefit from the support that we provide. I am your host, Darlene Mahoney, and I am excited to share the news that SeniorLivingGuide.com provides a one-stop shop to finding senior housing, including independent and active seniors, a new home, while providing an excellent resource to assisted living, skilled nursing, memory care, or even home health and caregiving services solutions, and one easy-to-navigate website. So visit SeniorLivingGuide.com today. And I would also like to thank our podcast sponsors, Parish Healthcare and Parish Medical Center. At Parish, they offer the Parish Senior Consultation Center and Parish Senior Solutions, where each patient's evaluation and follow-up care will be personalized to meet the needs of the individual and their families.
At Parish Healthcare, we believe in our community. We believe in keeping our community safe. We believe in the art of healing. We believe in healing patients, healing families, healing communities. We believe in the best and brightest working together for the common good. At Parish Healthcare, our team focuses on you as an individual because every life is a work of art to us. Parish Healthcare, where the art of healing comes to life. Visit parishhealthcare.com/healthaware for a free health risk assessment.
Today, we are welcoming Liz Dewani. She is a public affairs specialist for the Social Security Administration, and she began her career with the administration in 2002. And she worked in many Social Security offices around the country as a bilingual claims specialist, including the Dallas region for the Houston and the Dallas offices, and in the Atlanta region for the Atlanta office. Liz has routinely assisted with special projects and has also partnered with the Richmond, Virginia Public Affairs Specialist team to support Social Security Administration's missions. Liz has received numerous awards for her dedication to the mission of the agency, including a commissioner's citation. Liz has also worked with us on a number of different outreach programs here on SeniorLivingGuide.com. She's done a previous podcast on Social Security, and she's also done some great webinars for the senior housing industry for the folks that work within the industry. We welcome you, Liz, to the podcast as we talk about Medicare Matters. Thanks for joining us today.
Thank you. Thank you for having me.
Yeah, absolutely. So we're going to chat a little bit about some good news for seniors. COLA, Social Security, is going up in 2023. So that's good news. I always like to open a podcast with good news, right?
Yes. And for those that don't know what COLA means, COLA stands for the cost of living adjustment. And as you know, inflation is going up. People are asking for higher wages. We were just talking, go to the gas station, try to buy some gas or buy some groceries. So we actually had a huge increase compared to our previous years. Social Security benefits and supplemental security income payments for approximately 70 million Americans will increase by 8.7% in 2023. This is the annual cost of living adjustment. By law, federal benefits increase when the cost of living rises, as measured by the Department of Labor's Consumer Price Index for urban wage earners. This will take an effect January of 2023, and increased SSI payments will begin on December 30th. So by January 1st, they should be receiving a higher benefit. So that's great news.
That is great news. And, clearly a lot of it is so needed as cost of living's going up, cost of housing's going up, everything across the board. So that should hopefully take off some of the pressure of those increases in just your daily living. So good news for our seniors there. So let's dig in and we're going to talk about Medicare because we haven't talked about that with you. So what is Medicare? Let's just start at the basics. What is Medicare and who can get Medicare?
Medicare is insurance. So every time you do work and you're paying into Social Security, you're paying into FICA taxes, right? So every time that you're working, you're paying 7.65%. And the breakdown of the 7.65% is that 6.2% is your money. So that's that Social Security check that everybody's looking to get. And 1.45% is your Medicare Part A. For the Medicare Part A, which covers 80% of your hospital bills. Medicare Part B covers 80% of your medical insurance, your medical bills, or doctor's bills. So Medicare is our country's health insurance program. Although most commonly used by people age 65 or older, some younger people are on Medicare, are eligible for Medicare too. Those include people with disabilities, permanent kidney failure, ALS, Lou Gehrig's disease. Medicare helps with the cost of healthcare, but it does not cover all medical expenses or the cost of most long-term care. But Medicare has 4 basic parts: Medicare Part A, B, C, and D. A covers the 80% of hospital bills, so you usually work and pay into that, and then your employer matches that. So again, 7.65% is what's deducted from our check, and then times 2 is a little bit over 15%. The breakdown, the 6.2 is your money. That's what you're going to get back. So times 2, because your employer matches it, is 12.4% with money. And then the 1.45% is your Medicare Part A. So this is a big relief because if you don't work and pay into Medicare, that Part A cost is very expensive. It's a higher cost than the Part B. This year, the Part B cost for Medicare for those that need it for medical or doctor's bills is $170.10. Next year, it is going to be going down a little bit. So that's, again, great news because of the cost of living increase going up.
More great news. I love that.
Yeah. So the Part B will actually, that premium will go down, but it's definitely the country's health insurance program. And then C and D are for the other 20%. So A and B cover the 80% of hospital bills and 80% of doctor's bills. And then C is your Medicare Advantage plans. And then D is your prescription drug coverage. You could always go to CMS, Center for Medicare and Medicaid Services, for more information at www.cms.gov. I know that C and D, there's open enrollment. And if you want more information on which plans to choose, if you're trying to change your plan, you would go to healthcare.gov. So that would be where you would go to kind of look through plans if you're looking to change anything.
Is that where you go to sign up for it?
For Medicare Parts A and B, you could actually go to our website, www.ssa.gov, and you could do it online. Or you could try to schedule a phone appointment. So if you already have Social Security benefits, if you're already receiving Social Security benefits before you turn 65, we'll automatically enroll you in Medicare hospital insurance and the medical, the doctor's insurance, that's Part B. So you'll automatically get a card in the mail. We'll mail you all the information you need a few months before you become eligible. Note, if you have any listeners from Puerto Rico or foreign countries, they won't automatically receive Part B. You do have to file for that. Now, if you're not on Social Security benefits yet,
okay,
but you do want to go ahead and apply for the Medicare, you can do that 3 months before you turn 65. The month you turn 65 or 3 months after, again, you could apply online or you could try to make a phone appointment by calling us at 1-800-772-1213. Our office lines, the 1-800-772-1213 line is available from 8 a.m. to 7 p.m., Monday to Friday. Our offices are available as well, Monday to Friday, 9 to 4. We are taking walk-ins, and you could try to schedule an appointment if you call the local office. To get the local office's phone number, you could go to our website, www.ssa.gov, and do /locator, put in your zip code, and it'll tell you which one is your local office. And again, if you go to our homepage, www.ssa.gov, you could click on the Medicare link. You'll see 4 links: retirement, disability, Medicare, and supplemental security income. If you click on the Medicare link on one of the boxes on the right-hand side, it'll take you on how you could apply online as well. If you're currently working and you're still insured, or you have a spouse that's working and you're insured under your spouse's group health insurance plan through their current job, you don't need to take Medicare at 65. You can delay it under our special enrollment period.
I gotcha. So one thing I did want to just kind of mention and get your thoughts as well is I was kind of going online, and there's a lot of websites out there that are Medicare type websites, but they're not the ones that you're referring to. So there's a lot of websites out there. So I think I like the fact that you're sharing the SSA.gov website very specifically, because you can get lost in what looks like different types of websites, and they're not the ones that you're referring to. So whether they're official websites or not, it's sometimes can be very difficult to tell.
Well, .gov helps. If it's CMS.gov for Center for Medicare and Medicaid Services, SSA.gov, SocialSecurity.gov, Healthcare.gov. So if it's a .gov, usually that's good. That's a good one.
That's a good sign. So that's something to be very cognizant of, is that .gov in that website URL. That's an official website versus something that you may be getting off track on, and you may be getting into the weeds on something that's not an official website. So that's a good notation as well. So thank you for sharing that. We talked a little bit about different types of Medicare. So how do you sign up for the Part B if you already have Part A? And is there a specific time that you sign up for it, or can you sign up for that at any time?
If you already are enrolled in Medicare Part A and you want to enroll in Part B, you would do that if you opted not to take the Part B under the initial enrollment period, because when you got the card when you were closer to 65, that was probably during your initial enrollment period, right? So we have different enrollment periods. When we send you the card, or as soon as you turn 65, 3 months before, the month of, or 3 months after, usually you'd be eligible for both A and B. But you opted, or the person opted not to get the B because they were working under a group health insurance plan. They were still working through a current job and insured under their current group health insurance plan. Because, people, they like to work. They'll work until they're in their 70s, even in their 80s, right? Just nonstop workaholics. So they might be like, why should I pay 2 premiums if I don't have to? I'm already working and paying a premium through my employer, right? With my health insurance through my job. Or they might have a spouse that's a workaholic. And, they're under their spouse's, group health insurance plan, or they married somebody younger and they're under their group health insurance plan. You could defer it for special enrollment. So you can apply for the special enrollment period online. We have links to that. So if you go to our website, again, ssa.gov/Medicare, or just go to our homepage, it'll let you know what you need to do to apply for Medicare Part B online during a special enrollment period. You can upload your application and documents and verify your group health plan coverage through your employer. So there's no penalties because you waited after 65, but you did have proof that you were covered under your group health insurance plan. You could also fax or mail your completed forms. That you would need is a CMS 40B, which is the 40B, the application for enrollment in Medicare Part B, and the CMS L564, request for employment information. Employment forms are evidence of employment. Again, you would be able to provide that form and evidence of employment to your local Social Security office. We need that form. The CMS L564 is what your HR fills out, or your spouse's HR fills out if you're under their health insurance, to verify the dates of coverage, the dates of employment. If you're delaying it because you have insurance through a former employer, then that's not under special enrollment period. That would be under general enrollment period, and usually there's penalties applied for that. So it's only applicable. Special enrollment period will let you waive any penalties for every year that you waited past the age of 65 if you have insurance through a current employer or a spouse's current employer. And that L564 is very important, because you don't want to not have that filled out and then pay for penalties if you don't have to.
So what is a penalty?
So for every year you wait past the age of 65 and you didn't take your Social Security Medicare, you didn't take your Medicare the month you turned 65, 3 months before, 3 months after at initial enrollment period, or if you didn't have coverage through your current employer or your spouse's current employer, and you just didn't take it because maybe you felt like you were in great health, you didn't need it, and then you figured, okay, I'll take it when I need it, right? Because everything's expensive. I don't really want to pay for another bill, Well, if you do that, For every year you wait past the age of 65, there's a 10% penalty. So that would be under the general enrollment period. And you don't want to do that. Like I said, if you have insurance through a current employer or a spouse's current employer, that's the only exception. One thing about TRICARE, because I know you might have a lot of military veteran listeners or active duty listeners as well, is if you're going to go from TRICARE Prime to TRICARE for Life, it's not automatic. At 65, you do need to file for Medicare. That is something that TRICARE actually wants you to do. That is a rule under TRICARE, but you do have to file for it during your initial enrollment period, 3 months before you turn 65, the month you turn 65, or 3 months after. So it will then convert over to TRICARE for Life. The special enrollment period would not be applicable even if you're working and under your current employer's group health insurance plan or your spouse's current employer's group health insurance plan, because for TRICARE for Life, you do need to have Medicare. And most people do that at 65.
Okay. All right. So that's really interesting. I'm so glad we have you on here because this is not for the faint of heart. There's a lot of information and it's definitely so many moving pieces to this. What is the monthly premium for Part B?
So the monthly premium for Medicare Part B in 2022 is $170.10. So that's the monthly premium for Medicare Part B in 2022.
Okay.
But that information comes from the Center for Medicare Medicaid Services.
Okay. So people talk about veterans benefits. Is that referring to the same thing as TRICARE, or is that something different?
No, TRICARE is the insurance. So Medicare will cover primary. That'll be the 80%. TRICARE for Life would become their secondary insurance. So you know how when you turn 65, closer to turning 65, you get or as soon as you sign up for Medicare, you get all sorts of things in the mail from Humana, AARP, Blue Cross Blue Shield, all the different insurance companies, right?
Yeah. It blows your mind. It's like eeny, meeny, miny, mo.
Exactly. Understood. Yeah, it's a lot of information and you're just trying to figure out what's best for you. And now you're on possibly a fixed income because you're not working anymore. You're going to be on Social Security. What TRICARE is for military personnel, if they choose to get on TRICARE or whatever qualifies them, that covers the other 20%. So instead of going through the private industry, they actually would be eligible if they want to keep their TRICARE Prime. It'll go over to TRICARE for Life, and that would be the other 20%. So that's TRICARE. Military checks is based on what they've worked with the military, the fact that they've served or whatever it is. So that you would have to go through the OPM or military personnel to see, how that works. That's different than Social Security.
Okay. So veterans benefits, that's something that, should they get the Medicare Part B or no?
Now, again, a lot of people, not looking at TRICARE, but a lot of people, they have free medical coverage through the VA, different than TRICARE. So, they might say, I don't want Medicare, because I have free coverage through the VA, any VA I can go to. And we've seen that a lot. A lot of people just might not want Medicare because they might be like, I don't need it.
But they can opt for it regardless. They can have both.
Yes, you can have both. But, if they have free healthcare from the VA, a lot of veterans opt not to take it. But remember, if you don't have insurance through a current employer or a spouse's current employer, when you turn 65, so you wouldn't qualify under special enrollment period, and you didn't take it during your initial enrollment period, like I said, TRICARE, they do want you to take it so that they could cover you for the other 20%, while Medicare covers you for the other 80%. So if you're just getting free coverage with the VA and you want to take it after you turn 65 and you didn't have insurance through a current employer or a spouse's current employer, then you would be paying a penalty. So again, we have seen a lot of people just opt not to take it because they have the coverage, the free coverage from the VA, different than TRICARE. And then once they come, if they ever need it again, then, they'll pay that penalty.
So does it make a difference if you have a higher income? Does that affect your premiums for Medicare?
It could. The base premium for Medicare is $170.10. That's for 2022. Now, in 2023, premium is going to be a little bit less. It's going to be $164.90. So that's always good because it's going down while cost of living is going up for our beneficiaries. So that's great news. when we're looking at if you actually will have to pay more, they're looking at from the last 2 years. So we're in 2022. So whatever you've made in 2020, that adjusted gross income amount that's on your tax return, depending on how you filed your taxes. If you did it married, filing jointly, or single, or however you did your taxes, and whatever your income bracket was. And there's a little chart. Through that, you'll be able to see, or you'll get a letter stating, hey, you actually owe us a little bit more. But there is a workaround.
Tell us about the workaround.
So, well, not for everybody, unfortunately, but if you had a life-changing event, so let's say 2 years ago, you were working full-time, you were single, so all the money was yours, you were working, life was good. All right, let's say 2 years later, you met the love of your life in 2 years. Now you're married, which is great. You're still living the life, but maybe your spouse isn't working or working part-time. So now, your tax information has changed, right? In 2022, it's going to be married, filing jointly. It's no longer single. And of course, and maybe you've retired, right? Or partially retired because you want to spend time with your new spouse. So then, of course, you would have to let us know, hey, I had a life-changing event. I got married and, I reduced my work. Or, you got married, but your work is still the same, but your spouse isn't working too much. So now you would meet under a different category because you're not doing it as single, you're doing it as married, filing jointly. But, your income is now shared, right, between you and your spouse. So again, that would be, a reason married. If you get married, if you get divorced, because you had two incomes and now you have one income, that's a possibility too. Work reduction, if you are retiring, so you're still working part-time, but haven't stopped quite yet. So work reduction, work stoppage, you are retiring, you're filing for everything. So there are a few different life-changing events. We actually have a form also on our website. So our handy dandy website, www.ssa or Social Security, you could spell it out or just use our abbreviation, ssa.gov, G-O-V. It'll take you to the same place. If you scroll to the bottom of that homepage, you'll see an icon for forms. Click on forms, and you could actually type in SSA 44. If you type in SSA 44, that's the form I'm talking about, life-changing event form. If you meet that criteria and you've had a change in the last 2 years and you're being told you have to pay a higher amount, you got a letter or something, then if you meet that criteria, you could possibly qualify for it to go a little bit lower or just pay the base. So it just depends on your situation. And then again, the CMS L564 and the CMS 40B, both those forms we talked about earlier when we talked about the special enrollment period and what forms you need and what your employer fills out and all of that. Those forms are also under the forms link.
Yeah, that's nice that you can go to that specific section and get all the forms that you need and hopefully get an exception if so needed. No one likes to go back and find out that they have to pay a higher rate on something. So that's great to hear. So I think we're going to take a quick break for our sponsors, Parish Healthcare and Parish Medical Center. And when we come back, we're going to dig a little deeper into the Social Security side. Since we have Liz here, we're going to definitely take advantage of that. So we'll talk about that on the other side of the break.
Hey, Mom, how's the retirement home search coming?
Oh my gosh, I'm just so stressed out. I don't even know where to begin.
Well, why are you so stressed? What's the matter?
I don't know where to find anything. I just need everything in like one place and know what all the options are.
Does the idea of searching for senior housing seem overwhelming and you just aren't sure where to even begin? SeniorLivingGuide.com has great news for you. We offer a one-stop solution to take the stress out of your senior housing search. At SeniorLivingGuide.com, both our statewide Florida edition book and website are created to make your senior housing search very easy for you to navigate. We provide details on communities, including retirement, assisted living, skilled nursing, memory care, and home health, allowing you to decide which best fits your needs and then connecting you directly with those communities. Visit us online at SeniorLivingGuide.com and start your search today
At Parish Healthcare, we believe every life is poetry in motion, motivated by strength and determination. As your bone, muscle, and joint healthcare partners, we believe in blending the art of healing with the science of medicine to keep your body in motion. We believe in healing patients, healing families, and healing communities. For a free orthopedic health assessment, visit parishhealthcare.com/orthoaware. Parish Healthcare, where the art of healing comes to life.
All right. Thank you, everyone, for joining us. We are back with Liz from Social Security, and now we're going to talk more Social Security. And I know that we covered COLA, the cost of living allowance, and the changes for 2023, which is good news for our seniors. I do want to ask, how can someone get help from Social Security? Because for a lot of us, it seems like this big entity in the sky. And I know we have Social Security offices, but can you just go down there, or can you call? I mean, give us the details on how we can feel more connected when we actually need help.
Oh, yeah, sure. We're available. I mean, if you need to give us a call, if you need to come into our offices, you could actually go into the local office and speak to somebody during office hours, Monday to Friday, 9 to 4. As I mentioned earlier, our 1-800 number is also available, and that has extended hours. So 1-800-772-1213. Again, that's 1-800-772-1213. Operators are there from 8 a.m. to 7 p.m.
And that's Eastern Standard Time?
Eastern Standard Time. Mm-hmm. And then we also have automated services on our phone as well. And that's 24/7. So if you're not a computer person, right, just not tech savvy, and 1-800-772-1213, if you choose automated services, if you need your benefit verification letter, or if you want to know where your local office is, punch in that zip code under office locator. Once you get that option, you need your Medicare card replaced. There's a lot of things that you could do with automated services 24 hours a day, 7 days a week. So definitely want to check that option out as well if you have to call us and you want to see what's available quickly. We have our locator link, www.ssa.gov/locator, but you could file for a lot of these benefits right at your fingertips if you are, okay with going online. We have a My Social Security account that you could log into, www.ssa.gov/my account, or if you go to our homepage, you'll see the link to my account. And if you remember do you remember getting those green and white statements every year?
Way back in the day.
Yeah. Well, we stopped mailing those out because of identity theft, or a lot of reasons, not only identity theft, but also budgeting, things like that. It is important that if you can create your My Social Security account, create it so that you could see your statement again, right? You want to make sure that the information that we have is correct, because that's your future benefits as well. There's a lot of transactions you could do with your My Social Security account. If you need to update your address, your phone number, your direct deposit, if you're on benefits, get your Medicare card replaced, get your Social Security card replaced. If you're over the age of 18 and a U.S. citizen and you just need your Social Security card, you could actually get it replaced without stepping into an office or even calling us or providing us any proof. And again, we're always available on the phone and online services. You could file for your retirement. You could just file for Medicare if you're not ready for a retirement yet and you need your Medicare if during your initial enrollment or special enrollment, disability application, spousal benefits. So there's a lot of different benefits that you could file for as well. Our homepage is a great way to start. So ssa.gov.
Yeah, I love the fact that, and you and I have talked about this before, so this isn't new for you and I, but for some of our listeners, it definitely might be the statement. I think it's important to know that you do have a statement. It's like having a bank statement that you never go and check. I know that a lot of people used to get their bank statements in the mail every month, just like what you were just referring to, and they don't get that anymore. It's automated. It may come to you automatically, or you may not even get it at all because you can now go online and just view your statement. I don't know that a lot of people are aware that they do have a statement for Social Security under their Social Security. So that's so great to get that information out there where they can go and check and see kind of what's going on.
Right. A lot of people just assume that Social Security is no longer going to be available because you don't get those statements, right? Out of sight, out of mind. You used to get them in the mail every year around your birthday. If you're over the age of 18, create your account. If you're, you have a Social Security number, whether you're a U.S. citizen or not. If you need a Social Security card, that's different. You do need to be a U.S. citizen for the card replacement to work online. But even if you're not, go ahead and log in because you could still at least see your statement.
Exactly. And if you can do something online easily, why would you want to go sit and try to get an appointment or wait at the office, et cetera? Because I know that sometimes that can be really time consuming. I do want to mention this because we've done podcasts on safety and, frauds and scamming has increased significantly, especially with our seniors. I mean, I talk to people quite frequently about different types of scams and they're getting very technically advanced in some of the things that they done. I know someone that it was a voice changing. It sounded like her son who was being called from jail and it was his voice, but they altered the voice to make it sound like that. So they had used something probably from social media, contacted her. So it was very advanced what they're trying to do. And then they had her cell phone number. So, I mean, there's all this stuff that's so readily available to scammers. So one of the things that I know is a popular scam is people calling seniors from quote unquote, and I use those air quotes, which you can't see, from the Social Security Administration. So tell us the truth on this.
Well, if you remember, there used to be that IRS scam call that people used to get too, telling them that their refund, something about their refund or something with the IRS. So these are scams. You are absolutely right. If there's a problem, we're going to mail you a letter. Okay, number one, we usually don't email you. If you've called us and we have to call you back for customer service reasons, yes, we're going to call you back. But if you haven't called us, then there's no reason for us to really try to contact you. And trust me, if you've been to the Social Security office, you would know there's no time for anybody to sit there and make scam calls. In 2019, it was 1 out of 10 people that were scammed, a victim of identity theft. In 2020, the year of the pandemic, that number grew and not in a good way. It's 1 out of 5 people. And again, scammers follow headlines, and there were a lot of different scams coming out at that time as well. There were people that were impersonating the Census Bureau. In 2020 was the year of the census, and a lot of people were saying they're from the Census Bureau and they need your Social Security number. The census does not need your Social Security number. Or a COVID test, right? They were saying that you could get a free a COVID test if you provide your Medicare number. Well, if it's free, why do they need your Medicare number? They don't need to be billing or needing your Medicare information. So if there is a problem, like I said, we'll mail you a letter. Generally, we only contact you if you've requested a call or have ongoing business with us. Again, as you mentioned, the latest scam trick of using robocalls or live callers has increased, and fraudsters pretend to be government employees and claim that there's an identity theft or other problem with one Social Security number, account or benefits. Your Social Security number never gets suspended. Okay, even after you pass away, family members can get benefits off of your Social Security number under family benefits, right? Survivor benefits. If you see your statement, you'll see that you might have family members that could draw a survivor benefit check from your account, from your number. So that's your number always, okay? Scammers may threaten arrest or other legal action, or may offer to increase benefits, protect assets, or resolve identity theft. They often demand payment via retail gift cards, wire transfers, or prepaid debit cards, internet currency, or mailing cash. Our employees will never threaten you for information or promise a benefit in exchange for personal information or money. We may call you in some situations, but will never threaten you, suspend your Social Security number, demand, intimidate payment from you, require payment by cash, gift, prepaid debit card, internet currency, or wire transfer. We'll never ask you for a gift card numbers over the phone or wire cash. We would never ask you to mail cash. Ask for personal details or banking information to give you a cost of living adjustment, okay? So don't be fooled. You should always look out for a caller saying that there's a problem with your Social Security number or account. Any call asking you to pay a fine or debt with retail gift cards, wire transfers, prepaid debit cards, internet currency, or mailing cash.
You're on a roll, girl. So yeah, and I'm even thinking, I don't know if you mentioned it, but Bitcoin is definitely one that's been used quite a bit lately because I think some of it is because it's untraceable. So
yeah, and then caller IDs too, right? Scammers also pretend using they're from the government agency by those fake caller ID numbers that look like they're from an official Social Security office. And we've had that. We've had people call back that number and actually get the Social Security office, and the office didn't have a clue what they were talking about when they did call back. Honestly, we do work with the Office of Inspector General, OIG, and we do want you to report those scams. The website, if you are able to do it online, is oig.ssa.gov. So oig.ssa.gov/scam or ssa.gov/scam. Definitely want to report those calls so our Office of Inspector General could figure out where those calls are coming from, where these reports are coming from, because they were able to bust a few culprits during the pandemic. There were people in North Carolina, huge banking hub in North Carolina, California, New Jersey. So there were a lot of people that did get arrested because of this.
Never underestimate the sneakiness.
Mm-hmm. Yeah.
Yes. So no, I appreciate all that. And I definitely getting that word out there so that, you don't make that mistake if you get that phone call. Is there anything else you wanted to share on the Social Security side before we sign off on this podcast?
Make sure, you do check out what you can do online for sure. So you don't have to call us and be on hold or come into the office and wait. You can go to our website, www.ssa.gov, create your My Social Security account. Again, you could file for retirement, Medicare, spousal benefits, disability benefits. And we are available, though, if you need to come into the office, if you need to call us, we're here. We're happy to help. We serve you. We're public servants. We're civil servants. So whatever you need, just definitely contact us if you need to. But again, there's a lot of different services available on our website, www.ssa.gov. We're going with the times. And again, we're all over social media. We have our own Facebook page and LinkedIn page and Instagram page, YouTube videos. If you need to go through any of our official YouTube videos to learn how to create your account, what it's good for, what you can do online, all of that information is also available.
Well, I'm just waiting to see Social Security open up a TikTok. That's all I'm waiting for.
Yeah.
I'm just kidding. I'm just keeping it light. I don't even TikTok, but sometimes they show up on some of my other social media feeds. Well, thank you so much, Liz. I really, really appreciate your time and joining us and sharing all this amazing information with our seniors and their caregivers and anyone else that's able to glean some information off of this podcast. And once again, everyone, thank you for joining us on this podcast and our sponsors, Parish Healthcare and Parish Medical Center. And thank you, Liz, so much for joining us on this podcast episode. If you enjoyed this podcast, we're available on Spotify, Apple Podcasts, Alexa, and more.